First Nations people in British Columbia are more at risk for some of the most commonly diagnosed cancers, including colon and cervical cancer. They're also less likely to survive a cancer diagnosis than non-First Nations people. Recognizing this, the BC Association of Aboriginal Friendship Centres, BC Cancer, First Nations Health Authority, and Métis Nation BC set out to develop a truly collaborative strategy that would improve Indigenous cancer outcomes by addressing all steps of the cancer journey, from prevention and treatment through to survivorship and end-of-life care. This work includes engaging with Indigenous cancer patients and families to better understand the Indigenous cancer journey and building organizational capacity to understand best practices in supporting Indigenous health and cancer control approaches. Feedback from Indigenous cancer patients and families showed a need to improve cultural safety in cancer care services, especially with regards to how care is transitioned between local health care providers and BC Cancer programs and services. Patients and family members also said there was a need for healthcare providers to be able to discuss traditional Indigenous perspectives on health and wellness, and for relationship-based care to include supports that extend beyond the biomedical services provided by Western medicine. Under the leadership of the late Preston Gunnu, Director of Indigenous Cancer Care for BC Cancer, the partners developed the Indigenous Cancer Strategy. The strategy provides a comprehensive roadmap for partner organizations to work together within existing and emerging systems and structures, and invites all health system and community organizations to play a meaningful role. This approach is unique in the province and the country, with Indigenous communities leading changes in cancer care in keeping with First Nations and Métis priorities. The end goal of the strategy is cancer services that align with Indigenous priorities, resulting in fewer new cases of cancer through healthy living, wellness and supportive environments, earlier detection through culturally safe cancer screening programs, high-quality, culturally safe cancer care and support for Indigenous people, families, and communities throughout the entire journey, support for the end-of-life journeys, perspectives, and wishes of Indigenous peoples and their families and communities, and that Indigenous cancer journeys are well documented and understood. For working to establish best practices to provide high-quality, culturally safe cancer care for Indigenous peoples of British Columbia, the Gold Apple Award for Collaborative Solutions has been awarded to the Indigenous Cancer Strategy.